Hi, Joe.
Hi, Carly.
How are you?
Good,
Welcome
how are
to
you?
the Fielding Dental Healthcare Podcast.
Thank you.
I am going to find out how you feel about some common tools we use.
Yeah, things we talk
To
about
keep-
in the operatory.
Yeah.
Okay.
So I'm going to say what it is, and then you're going to tell me whether I should use it or why you would recommend it.
Okay, let's go.
A regular toothbrush.
Well, some people like to use it when they're traveling if
Right.
you don't have an electric toothbrush. I definitely would not recommend a manual toothbrush. Some people find that it works better than the electric, and usually I like to say, well, maybe you're not using the electric properly then. There's a very different technique when
Okay.
it comes to using a manual toothbrush. It's a lot harder on your gums, it's a lot harder on your teeth, and it's just not as effective. So I wouldn't recommend a manual.
Okay, but we do need to brush our teeth. So my next question or my next option item for you
Yeah.
to let me know whether or not you recommend and why is an electric toothbrush.
So my favorite electric toothbrushes, there are two big ones on the market. So that's the Oral-B and the Sonicare is the other
Right.
one. Different shapes.
We do get a lot of those questions. Which
Yep.
one is the preference?
So my preference would be the Sonicare.
Okay.
The Sonicare has the traditional shape of a toothbrush. So it just gives you that little extra room. It covers a couple teeth at once. So you don't have to be so precise with where you're putting the toothbrush.
Okay.
It also does an ultrasonic vibration. So it's gentler on your gums if you've had areas of recession. And then the Oral-B is the round head one. I've used it as well because I like to try both products. The Oral-B, I find you have to be more specific on the tooth,
Right.
making sure you're getting all those areas.
Okay.
And it does an oscillating. So it goes like this, which can be a little bit more rough on the gums
Right.
if you have areas of recession and you're cleaning around that gum area. So that's why I'd recommend the Sonicare. But when you come to electric toothbrushes, I always like to remind my patients that you use them a lot differently than a manual. So when you make that switch, you have to make sure that with a manual, you're kind of doing this action, which is the brushing,
Right.
constantly moving your hand. When you're using an electric toothbrush, you want to make sure that you're holding it and sort of massaging the tooth as well as around on the gums. You
Okay.
kind of move like this along very slowly.
Okay, gotcha. Okay, I think I know the answer to this.
Okay.
Floss. Would you recommend and why?
100% I would recommend it. We do recommend flossing once a day.
Yeah, we know.
But I know that that might be unrealistic for some. So then we'll say, okay, maybe try to start 2 to 3 times a week. If it's just once a week, we got to start somewhere.
Right.
It's good to develop those habits when we're younger because then you'll be able to continue them when you're older. If you've never flossed before and you get to the point where it's really important to save your teeth that you have to floss when you're in your 60s, 70s, that's a little bit harder to get used to. The dexterity and getting sort of all those different areas in your mouth, it really gets hard. So the key to flossing, as I've said this before in our videos, is that you have to make sure you hug the tooth when you go in between the teeth.
Yes.
When you initially go through the space between the two teeth, you're cleaning in between, so that helps with cavities.
Yeah.
But you have to continue to go down along each side of the tooth into the gum.
It almost looks like you're going under the gums.
Yeah. You're going to scoop and then C-shape around the tooth, kind of pull it so that it cleans the
Right.
side of the tooth. Because the toothbrush
So what
isn't
about
gonna
a
reach
water
there.
flosser? Because I know
Yeah.
you guys learn after you've seen a patient a few times and we're trying the floss recommendation and that doesn't quite work
Yeah.
out.
Yeah.
A lot of our hygiene team does recommend a water flosser. What do you think about those things?
So the water flosser is great, but not to be confused with floss itself. So it is not a replacement.
Okay.
If you're currently flossing, I wouldn't say move to the water pick for that reason to
Right.
floss.
Stay with the good behavior.
Stay with the good behavior. Now, on that note though, so the water flosser, the water pick can really help if you have bridges, crowns, areas that you would like to get into the margins and kind of clean all bigger spaces. So you could add that to your flossing. You still want the floss for the tighter spaces. So I think I basically covered it there. No?
Yeah.
You don't.
You
yeah,
did a good job.
You can add the
So
water
floss
flosser.
is number 1, water flosser is number 2.
If you're not going to floss
Okay.
at all,
Okay.
then add the water flosser because you're at least adding something.
Okay.
Also, a lot of times people get the water flosser, it's a big mess. Be prepared for it to spray
Yes,
everywhere.
I do hear everyone recommend do it in the shower.
Yes, do it in the shower because it's not really effective. If you put it on like a nice lavage, a gentle stream.
What is a lavage? What is that word?
Can you imagine? I'm just trying to describe.
Where did you come up with that word?
A
Do you say
gentle
that to your
lavage.
patients?
I don't know, maybe.
Okay, I'm going to have to fact check lavage.
All right, what
I
do you
mean,
want me
it
to say,
sounds
like a
great. You made
gentle
it sound like a
stream?
spa
A
appointment.
gentle stream.
If
It's
you are
not-
lavaging your mouth. Okay, moving on.
You might
Bidet
have to
for your mouth.
increase. Yeah. You might have to increase your intensity.
I'm
for it
going to
be
go buy a water
effective.
flosser now just because you said lavage. Is there a lavage
no,
setting?
no.
Anyways, moving on. Whitening strips.
Whitening
Store-bought.
strips. Store-bought. Okay, so the difference with the over-the-counter and the professional type that you can get in the office, dental office. So the whitening strips are great for surface stains. So your daily generation of staining that builds up, you kind of throw those guys on. A lot of people have good results with it, but it's only going to attack those daily surface stains that are generated. If you naturally have like a yellow brownish color to your tooth and you'd like to brighten those, it might not be as effective as you'd like because it's not going to penetrate into the tooth.
Right, so you need a stronger solution that we have.
Correct.
Right.
Any other questions?
Okay, what are those things like the Stimudent?
The picks.
Yeah.
So the green, they like to call them the green trees, or
Yes.
the little picks to go in between your teeth. Mm-hmm. So a lot of times,
That's like, there goes floss, water floss, Stimudents.
I might say floss, Stimudent. Well, Stimudents is like a wooden pick. They don't really recommend those.
But
as
isn't
mu-
there
as
like a
much
rubbery
anymore.
one too that you can
Yeah.
kind of go around the gum line with and
those are the
remove the
soft
debris?
picks.
Okay, soft picks, sorry.
And then also some people use the like fork-like one that has the string, the floss in between it.
Okay.
So you could use those as well. So if you use the soft picks, they're the green trees. They're really great if you have like a larger space in between your
Right.
teeth where the gum kind of points up. If that's really tight, you might actually damage your gums trying to
Right.
poke that through because you have really nice healthy gums and they're nice tall peaks.
So you can come every 6 months.
Yeah.
You have healthy gums.
So using just the basic floss to kind of go in between the surfaces is probably the way you want to go. But if you have a larger space, the soft picks are good.
Right. You just can't get away from the floss.
No,
Okay.
that's a good. That's
All
a
right,
good-
tongue scraper.
But did I address the other?
I thought you said it was good.
Okay, so yeah, because you want to know the soft picks. Some people do use that fork one though. I just wanted to mention that one's really great to get in between the teeth if you're not able to, use your fingers to get in your mouth.
Yes, yes.
But you also want to
kids
make
and
sure
for
you're
seniors.
pushing, towards
Yeah.
the tooth, and then you come up, and then you push towards the tooth.
Okay.
Again.
We'll
I
do an
wanted to make sure I
instructional
said that
video about that at another time.
on your
Tongue scraper.
mouth. Tongue scraper. So again, that's a great.
What in the world?
What is it? So they come in different types. Some have just like this plastic piece that you hold and you kind of pull forward on your tongue.
Is this like a bad breath thing?
Yeah, it helps with bacteria that builds up in your little tongue hairs.
Oh,
And simply just kind of using the tongue scraper, you can gently use it daily.
so
if
just
you
like
need.
brushing your teeth, brush your tongue.
Yeah, just do like a quick little brush there. You can
Yeah.
try using your toothbrush if you'd like.
Is
but
that a
the tongue
thing like
scraper's
you can
great.
tell the color of the tongue or what the tongue looks like? Are you guys
Yes.
checking that as hygienists?
Yes.
Okay.
So there's.
Do you recommend a tongue
There's
scraper
something
a
called
lot?
a black hairy tongue.
Oh.
Sometimes you can get a little bit longer hair follicles like on your tongue.
Okay.
They're not really hair follicles.
So
but they'll-
then you would need like a tongue scraper more.
yes, to help with the
Okay.
discoloration. Definitely helps with bad breath.
Okay.
Helps remove that bits of bacteria that get stuck in there. When we were in school, we actually would eat an Oreo, and just by like simply brushing your tongue, you'd see how much, without even knowing it, actually
Got
got
stuck
into
in
your
there.
tongue.
Oh my gosh.
Because you.
Why haven't you ever said that? That's such a great child activity we could do to show people like nobody thinks of brushing their tongue.
Yeah.
Okay, well,
Oh,
I think
gross.
that was some good tips on things that we should be using at home. And
Can we talk about one more thing?
Oh, yes.
You cannot shut down a hygienist. Come on. So if you have a lingual wire, I see this a lot.
Okay.
Lingual
Are we
wire.
going back to flossing?
Maybe.
Okay.
So if you have a lingual wire, which a lot of our patients do because they've aligned their teeth, so that's easier to keep clean, but they have wires, so it gets a little
Yeah.
trickier in the front. So ideally, you want to use a floss threader So there's two different types, really. There's one that's attached to the floss and one not attached to the floss. I do find the one that's not attached is a little handier to use because it's a little thicker and a little easier to get through and handle.
Sometimes hard to get through though if those spaces are tight.
If they're tight. So
you
if
just
they're
use the
tight, you
threading.
want the one that's attached. And then you go in between and floss like normal. Don't
Yep.
pull up on the wire, it'll pull the wire out.
It will also help maintain your wire because people are always like, I don't understand why this thing keeps breaking or coming off.
Yeah, bacteria, everything breaks it down. So you want to keep it really nice and clean.
When you look back there and you see the plaque buildup, you can see exactly what happened.
Yeah. But I wanted to say that if you're not going to floss, which I do find this with a lot of my patients that have lingual wire because it does take a little more time, picks do help just to kind of get in and under the wire and just clean a little bit of that bacteria up. So if you're not going to floss at all or you're not going to use the flossers, please try to get the pick in there because it'll just maintain it a little bit better. So when
Got
you
it.
come in for your cleanings, it doesn't take as much time to try to get all of that cleaned up and maintain your wire.
All right.
Yeah.
Well, thanks, Joe. That was some really great tips on our hygiene tools that we should be using at home.
Yeah.
Number 1, floss.
And an electric toothbrush. I would maybe say electric toothbrush first.
Okay, number 1, electric toothbrush. Number 2, floss. Thank you, everybody at home listening. Well done. You made it all the way to the end. If you have any questions or you want anything for us to consider talking about next time, let us know.
We'll talk soon.